The world, especially the dental world, lost a true legend when Bettie McKaig passed away. To me, she wasn't Dr. McKaig, though. She was my Aunt Bettie. She was my biggest fan, my friend, my mentor, and a leader who I looked up to and always will. Aunt Bettie gave me the countless hours of advice, both personally and professionally, and I am forever grateful for those deep conversations that pushed me out of my comfort zone. If she were here with us for the Bettie R. McKaig Memorial Lecture Series, I know that she would inspire you just as much as she inspired me throughout my life. In fact, she would encourage all of you to be resilient, stay patient, learn from others, and show some grit. I'm a better person, I'm a better woman, and I'm a better leader because of Bettie McKaig. My hope is that my aunt's trailblazing examples of leadership will live on forever, and that we will continue to draw inspiration from such a fabulous leader. Thank you so much.
So welcome everyone. ICD Online is a digital platform for college communications, providing greater outreach and engagement with fellows and the dental community worldwide through live and recorded webinars, videos, and other online content. ICD Online offers innovative means for connection, education, and research in an increasingly virtual world. This production is an installment of the Bettie McKaig Women's Leadership Series and is a series of programs dedicated to women leadership within the ICD and the dental profession, providing a platform for female leaders to speak about their experiences, challenges, opportunities, and contributions, as well as share leadership resources and information. I am Dr. Lisa Bentley, and I am honored to be your moderator today. I currently serve as the president-elect for ICD Canada. It is my privilege to introduce our panelists for today's discussion. Dr. Lois Cohen is a consultant and Paul G. Rogers Ambassador for Global Health Research. She is a research sociologist, retired from the U.S. government's National Institute of Dental and Craniofacial Research, where she last served as the Associate Director for International Health. Welcome, Dr. Cohen. Dr. Eleanor Fleming is the Assistant Dean of Equity, Diversity, and Inclusion and an Associate Professor at the University of Maryland, Baltimore School of Dentistry. Dr. Fleming holds leadership positions in the American Public Health Association and the American Association of Public Health Dentistry. Welcome, Dr. Fleming. Dr. Tina Masami is an oral and maxillofacial surgeon who is the founder and director of the Dr. Borna Masami Commemorative Foundation, a Canadian non-for-profit charitable organization in honor of her late brother that provides free dental and orofacial reconstructive surgeries to women who have survived domestic violence. Welcome, Dr. Masami. Dr. Meera Verma is the first female president of ICD Section 6, India, Nepal, and Sri Lanka. She is the founder and president of the Indian Dental Association, East Delhi branch, and also the founding member of the Indian Academy of Restorative Dentistry. Welcome, Dr. Verma.
Thank you.
Today, we will examine the current status of women leaders within the global oral health sector and identify pathways to leadership, challenges and opportunities, and identify barriers or obstacles women dental leaders face. Okay, panel, let's get started. At any point in your journey, have you experienced challenges accessing education or professional training opportunities as a woman? Were you treated differently or provided with different opportunities due to being a woman? How did your teachers engage with you during and after your academic and/or professional training? Would anybody like to get started with that question? Okay, Dr. Cohen.
Well, I may be the oldest one on the panel, I'm not sure, but I started my career in the 1960s, early 1960s, and it was an entirely different era. I encountered many barriers and starting in the educational domain, and that is when I tried to apply for fellowships to go to graduate school. I was actually denied a rather important opportunity because I told the interviewing committee that I needed to go to that particular institution because my fiance was there and we were going to be married, that was a no-no. And so I lost that opportunity. I remember having to discuss it actually with my major professor. Should I tell the truth why I wanted to go to that particular university? And the male mentor said, it's really up to you. But I thought I needed to be honest and say the truth, and that was a problem. So from then on, I learned how to sort of tailor my answers around about way, so I could have equal access to a fellowship opportunity, which I eventually did get. But it's a different age now, and I hope young women of today don't have that kind of a barrier. And in fact, getting a job was also, that was a legitimate part of the job interview, was, are you married and are you planning to have children? Those were the questions, and they could, ruin your chances for getting the job if you answered in the affirmative. So I'll start with that.
Can I speak?
Dr. Verma, please.
Yeah, I qualified in the year 1981, got into dental school in 1977, and in the city of Mumbai. And there we had this system where, a lot of us appeared for the examination and we were picked up on merit. So there was no real problem getting admission into the institute. And I got into one of the premier institutes of India. And since there was no problem regarding the academics, the teachers treated you differently. They did not put you down. They, in fact, encouraged us. And even being a girl student, it did not really make any difference. They gave due credibility to everybody, and they, let us showcase our talents and encouraged us. So I feel that I somehow did not get this basic, go through these basic issues in college, which would be detrimental. And that gave me a boost. I kept thinking that I can do more and more. And then plus, not only is it, the family also played a role. The family played a big role. We are 3 sisters, and my mother was our pillar of strength. And she felt that what the boys can do, you can do better. So, that was something which really energized me. And I went ahead and I qualified, and I am very happy. And I think this is one of the best decisions I've made coming into dentistry.
Amazing. Anybody else?
I'd love to share my perspective. That's wonderful, Mira. I agree with you on so many of those points, especially the fact that I had no issue getting accepted into dentistry, and then following that, getting accepted into my top choice of oral maxillofacial surgery based on merit. And I have to say that I always say, if I had to do it over again, I would probably choose the exact same thing, but I wouldn't worry so much in the process. And majority of my mentors in my early days of career were in fact men. These were men that I revered so highly, and they shaped the person that I am as a surgeon and my career. But maxillofacial surgery and many specialties in dentistry and all surgical specialties in medicine are extremely male dominant. And to this day, even in Canada and the US, this remains a concern of mine, that the change, although it's happening, it's extremely slow. I think oral maxillofacial surgery and neurosurgery are amongst the worst programs in admitting women, where the women's presence makes up less than 9 or 10% of the overall population. So it's changing ever so slowly. And I would really love to see more women get encouraged to participate in these programs. But in my experience, when it came to being in the workforce, when it came to being competitive, if you will, when it came to performing complex surgeries, trauma reconstruction, and then establishing practices, applying for promotions, applying for leadership positions, that was when I found that I was repeatedly overlooked and passed over for male counterparts with obvious inferior qualifications. And I have to tell you, as someone who's a female in a male dominant profession, and as someone who is in a minority group and an immigrant in Canada, it took me some time to clue into what was happening and why I wasn't more successful. So, as long as I was in the Middle East, I completely agree with Mira that I didn't perhaps feel some of these discriminations, but I did in North America, which I found very surprising. As our host who opened the program mentioned, that the best thing to do is to be your own authentic self. Well, it's really hard to be your authentic self when your authentic self is being described as maybe being too loud and being too involved or too tenacious. And so whereas these are characteristics and qualities that in men they're revered and sought after, but in women, sometimes people shy away from these things. So, to summarize, it wasn't until later, maybe in my mid-career, that I started facing these obstacles, and I became very resolute in breaking down barriers.
Thank you so much.
I think similar to what has been shared, as I think about the question and my lived experience as a Black Southern woman in the United States who has achieved a very unique academic path in terms of education. I was poured into by my family, my mother, my grandmother. Like I only saw excellence in Black women being successful, and that definition of success being different depending upon one's walk of life. But I share that because to the degree that I was told that I could not, that never occurred. And in fact, in educational settings, like I feel that I was supported in ways that most people did not get. Black, white, boy, girl, we didn't have non-binary, but you get the point. So I feel like I navigated education in a very privileged way. And the rubber didn't meet the road until I got into the professional world. And ironically, professional world where I was being asked to lead, or I was being asked to take all of that education and to put it into practice. Like that's where, for me, the challenges occurred. And, Tina, it's interesting that you named this as happening like mid-career, because I think if I am honest and looking back at my professional life, for me, it started day one. I was just, I think, naive enough to think that what I was experiencing was about something else other than naming what it was, which was oppression and power and privilege and all of those things that keep minoritized people, however they are minoritized, in places where there's imposter syndrome and doubt and things of that nature. So again, aligned with what others have shared, I just want to name that in the space of educational achievement, my experience, I think it's very singular, in part because of the space where I was, and also because I'm my mother's child and my grandmother's grandchild.
I just wanted to share that my first week of dental school, one of my professors said, "Bentley, does your father know you're here?" And I said, "Sir, my father drove me here." And he responded, "Well, this is no place for girls." And my response to him was, you know, my dad worked in a factory his whole life, and I'm going to be the first doctor in my family. And my dad is so happy I'm here because I'm going to have a better life. He looked me in the eye and he goes, okay, Bentley. And we never had a problem after that day. So it's kind of a funny story. Dr. Cohen, you wanted to add to the discussion?
I just wanted to add, yeah, please.
No, I'm thrilled by this interchange because it reflects, of course, as a sociologist, I'm looking at this, and also from my personal experience of entering this field in the 1960s, and here it is 2024, and seeing people of different ages entering in at different stages and encountering a different landscape. Because when I came, there were I'm not a dentist, but I came in as a sociologist studying dentistry and studying the workforce. And the workforce was 99% male in the 1960s in the US. It wasn't that so in all other countries, which I later found out that we had a unique way of thinking about dentistry, and it was very male. And we had a pioneer woman dentist, the first woman dental dean in the United States was Dr. Jean Sinkford, who was dean for almost 17 years at Howard University. She was the only one for all those years. And even when she stepped down to go to the Association for Dental School Education, at the time it was the American Association of Dental Schools, to try to build the workforce for females in the U.S. workforce. There still weren't women deans, and it took her many years of dealing with the pipeline and getting grants from various foundations to work on it, and until we had women increasing enrollment in dental schools, eventually getting to be on faculties and department chairs. And we even had some women become president, not only deans, but presidents of universities. So there were many programs out there that had to be constructed from scratch to make this happen. And I really give it to, applaud Jean Sinkford in this country for being such a leader. And of course, Dr. McKaig for demonstrating leadership in the International College as one segment of the oral health professions. But later on, my profession, of course, as many of you know, took me globally. And I was able to see that dentistry and the workforce are not the same in every country. And it's wonderful for Mira to talk about India, because that is another example of a country that could develop alternative ways of looking at the workforce. And in Southeast Asia, where sometimes women dominate the workforce. Now, the other point I wish to make, and I'll shut up for a while, is that leadership, you raised the question of leadership. It's like school teachers are mainly women, but for a long time there were no principals of schools or superintendents of schools who were women. They were all male. So women, like nurses, can dominate a workforce, but leadership is something else. It's another layer that we have to overcome to fit in and to rise in the structure. So women, even in Southeast Asia, while they dominated the regular workforce, it took a while for them to lead the workforce. So that's another thing that we should be discussing, the special attributes of women's leadership and the characteristics. But I'll let some others speak.
Dr. Verma, did
Can
you
I
want to
speak?
that? Yes.
Yeah, Dr. Cohen, thank you for giving us such an insight of what you have seen and what you have been through. Because for us, in the current scenario, you feel it always existed. In India today, I think about 80% of the students are women, are girls. And as you rightly say, that though they are there in the force, but at the leadership level, very few exist. And I somehow feel that once one qualifies, once one studies, one just first should master the subject, because once you're in master, you get that confidence to speak. And once you get the confidence to orate, to think clearly, to think for your profession, to think for the community, and to think how we can, let the profession grow in the country. Only then do the leadership qualities come to the surface. It's after a certain amount of experience that you are able to impart what you have gained. And we find that a lot of women in India are very capable and very forward thinking, but the opportunity, there may be a lack of opportunity, a lack of support, which they look forward. So we have, these leadership issues. We would like more and more. We are getting there, but we are not there yet. But we would certainly like to see many more women at the head table.
That's a good segue into our next question, which is, what are the most dominant traits or skills you have personally contributed to the success of your leadership? I open the floor.
I mean, I hate to sound like a broken record, but my greatest leadership skills I got from my grandmother and my mother. And I think that is, the sense of how you show up in the world and see people. So I was always taught that you are kind to everyone, from the housekeeper, janitor, to the decision maker and the C-suite, right? Like you show up for people, and you show up for people in ways that are true for how they need you to show up. You operate in this world with humility. And my grandmother always said, be careful the people you think you can, trip over on the way up, because on your way down, you're going to meet those same people. And so the degree to which, for me, I never embrace the title leader, because that's not who I am. I'm a person who shows up and tries to do the best in community with other people. And I think also this kind of skill of deep listening, and listening not just for the sake of, what am I going to say next, but really trying to understand people and needs. And then I'll just add, for kind of that last quality that I see in myself that I know I get from home, is curiosity, and the ways in which we can show up with curious minds, but I also think critical minds. And, I think it's interesting, this idea that was named of, people learning skills. And once you kind of have mastered a subject, then you become a leader, which I think is something that often women and minoritized people think, that we have to be the master of a topic before we can be the leader. Because I think for a lot of dominant people, they just show up to be the leader. Skills or knowledge, means nothing. Like, they can just lead. But for me, I think the ability to think critically and to always be curious about the spaces that I'm in have made me, I think, an interesting person. And if that interesting person happens to do something in a leadership capacity, so be it. But I think those key qualities, and again, I got them from my mother and my grandmother.
Sammy, did you have something to add? You're muted.
I was so careful not to make extra noise that I I really found over the years that my leadership strength it came from a place of compassion, and and whatever was the cause that I was leading, it had to be bigger. It had to be bigger than myself. It had to be a much bigger vision, and it had to be for other people. And so I'm much better leading when the intention is to benefit others. And, you know, I discovered that by chance after doing a few years of work with our charity, that I was very hesitant, for example, to advocate and fundraise and whatnot. And, you know, it was my husband that said, this is not about you. This is about them. So, you know, you're protecting these women. And so you need to speak on their behalf, and you have a platform and you have to use it. So, you know, these are things that I learned, that the older I get, the more I realize that, you know, being authentic and true to yourself and your integrity, I think, you know, staying with that integrity, what in your heart is the, you know, it empowers you and grounds you, is really important. And to select areas to lead that you feel passionate and devoted about, you know, I think that's also very important. But, you know, I lead with complete transparency, and I really believe in open communication. So, you know, it's served me really, really well. And I hope to continue to learn and find new and better ways to lead women.
Thank you. Dr. Cohen?
Yeah, this has been fascinating because, as it says, again, I'm wearing my sociology hat. Women leadership style has been studied a great deal, and we all are reflected in some of the, quote, stereotypical women's leadership style, or the feminine leadership style is a collaborative one, as opposed to the other end of the continuum of the masculine stereotypical style, which is much more authoritarian. But in point of fact, leadership styles have take the strengths from both sides. You know, effective leadership style tends to take the strengths of both feminine and masculine. So some situations, of course, will demand a collaborative style, which
Right.
is typically a feminine style. But when it comes to decision making, we often have to develop the confidence and expertise to make a decision in a much more masculine style. Doesn't mean that every situation is the same, of course, but those are just examples of why we might want to adopt a masculine style and learn from our male mentors in that particular way. But as a person who had to rise through a bureaucracy like the U.S. government is a terribly big bureaucracy, I had to do certain things too to lead. And one of the things I found is that I didn't know everything that I was supposed to know. And since I've been in the dental field, I'm not a dentist, I certainly don't know much about that field. I had to learn as I go along, and certainly still know nothing about clinical skills. So you have to recruit to your weaknesses. And that's how you gain expertise. I couldn't know everything, so I had to have a team there. Each knew something I didn't know. But together we can make a decision that's much more collaborative and makes sense in that particular situation. But that's just a my personal experience about it. That's been my mantra to my mentees as they come along. I say, you can't know everything. You need to develop expertise for sure in something, somebody won't respect you for what you know. But you can't know everything, and so we have to accept that and think of who knows something and bring them together in a team, especially in research, because research, if that's your career option, gone are the days when there's a single investigator working in their lab, all by themselves. Science doesn't operate that way anymore, and it's much too broad and diverse. We have to work in team science, interdisciplinary team science, not in our silo where we have been before. So that is where I come to where I am now with some of our residents who come to our institute and seek leadership advice. That's what my mantra has been.
Thank you. Dr. Verma, do you want to add to this conversation?
Yeah, I just want to say that Dr. Quinn very well said, and Dr. Maisami also, I think touched on all the points. I just wanted to add a little bit that, I do try to understand the problems of my colleagues, of my juniors, of my associates, and find solutions. I just would like to help them not only to stay within the academic run, but to grow as individuals, to grow in the leadership sector. And with a little encouragement, I find that people are ready to move ahead. It's just a little support and a little encouragement which is required.
Mm-hmm.
Thank you. What specific kind of support do we need from men as we go through the journey of gender equality and equity? Dr. Cole?
I know I had to learn how to network. They have all the information. They've been there first. So they're all networked. And I'll never forget how grateful I was to the male mentors I had who took me under their wing and let me shadow them. I remember being, mentored by Harold Hillenbrand, first executive director of the American Dental Association and president of the International Dental World Dental Fédération Dentaire Internationale, the International Dental Federation in English. But he was president and he let me shadow him. And that's how I learned how to navigate in a global setting, other dental associations around the world. And there were other mentors like that who let me shadow them and get into their networks. And I just am forever grateful for that they had the network and I didn't have.
Dr. Maisami?
I wanted to share an anecdote with you and tell you that, my first and favorite mentors were my father and my brother, who were both surgeons. And so being a young woman, I was privy to all the male conversations behind closed doors. They would tell me, this is how they think of you, and this is what they're saying about you. In particular, my dad had a very serious sit down with me and said, are you sure you want to, these are the most competitive and aggressive types of men that you're going to be working with all your life. Are you sure this is what you want? And my answer to that, was very naive. And I thought he was being misogynist, whereas he was just, as a father, being protective, having lived that same life. I think that having that early exposure where my best mentors were father and my brother, and also my best friends, being in a male dominant profession, have been men. I know the the male psychology quite well, and I work very comfortably within it. And there's so much that I've learned from them. And I will tell you, after the Me Too movement, and this is how much things have changed. After the Me Too movement, I have a lot of those same male surgeons coming up to me, and they feel close enough that they're like, okay, well, Tina's cool, we'll ask Tina. And what's going on in the world now? This seems crazy. And why are women so touchy all of a sudden? Why are they so sensitive? How are we supposed to behave? We can't even joke anymore. And women aren't the same. You guys were cool. And it was really interesting because they just need someone to enlighten them as to, what, no, we weren't so cool about it either, but we were in a different environment. And we felt that perhaps we would be compromising opportunities by speaking up. And so I think the role that men have is, and or what, where we can help them help us, is the fact that they need also a very loving, a very collaborative approach in reteaching them. They need to relearn the way to bring women into the communities and into the networks. And it's going to take a few generations, but we certainly can't do it without them. It has to be everyone putting in the efforts.
So everyone certainly should, put in the effort, but I want to caution us in kind of this line of inquiry to really think seriously around what allyship means, what being an advocate means, and also to consider spaces where we have seen throughout history. And I think, Dr. Cohen, as a sociologist, you may agree with me that, women have been remarkable in doing things in spaces where we are doing it for ourselves, for lack of a better term. And so to the degree that there is collaboration, that there is allyship, that there is sponsorship, that there's advocacy that is done, I hope that we are framing this and approaching this from a very balanced space, but also from a space that acknowledges that we have the answers and we can do these things ourselves. And to the degree that someone offering, opening the door to their network is helpful, like that's great, but I don't want us downplaying, which again, you see happening a lot in minoritized communities. You see operating a lot in spaces where folks who are similarly situated get the thing done without folks in the majority showing up and lifting a hand. And I think that for people who are women or identify as being female in any way, like we should consider that that can be enough too, and also not take on this added tax of educating people or supporting. I mean, you can do that if you want to, but that becomes burdensome work and labor where that's not our responsibility, right? My responsibility is not to the misogynists to explain to them problematic behavior and how locker room talk is not appropriate, right? Like we shouldn't take that on, and nor should we assume that we have to play those roles in order to get our foot in the door. And I'm not saying that anything that's been said leads to that point, but to the degree that we are critical and have broader lenses of understanding and appreciating the dynamic power of women and people who identify as being women, that I think could be an anchor, but also being very thoughtful and also critical in terms of where we expect advocacy and support and sponsorship, and where we are able to do for ourselves, which I think is in many respects some of the spirit that came from liberation efforts that were led by, for, and with women, with other people joining. So I just offer that as another way to contextualize how we might think about both the question, but also this broader issue as we think about oral health writ large.
Okay,
Eleanor,
Dr.
I
Cole, you wanted to respond?
just,
Yeah.
yeah, just to,
may I just say a few things?
Okay,
Uh,
sure.
Yeah, okay. See, women at different stages of life need different kind of support from their spouses, from their colleagues, everything. When they graduate from school, they are at par with the male population. They work equal number of hours, and they are equally productive. But when the family comes into play, their attention gets divided, and for some time they do find it difficult to put in so much into the profession. They may cut back a little bit. They need to understand, you cannot be judgmental on this. Everyone goes through it, but most of them bounce back. And it is, they cannot lose out. There must be some policy that you do not lose out on your promotions. You don't lose out, because this is a natural process which is taking place. You're rearing the family, etc., but you are giving to the profession. So some sort of, we don't ask that you be partial to us and let us get away with so many things. But what is absolutely essential, I think, some sort of thought, if the community, if the profession gives, that at this particular time a woman may be maybe 20% less productive. So it'll go a long way in encouraging a lot of women to get back to work. And another thing is that when women do come back, there may be a loss of confidence. There may be because of non-availability. You've not been in touch with the active profession. In that event, some sort of support, and the men definitely need to look at things from a women's perspective also.
Dr. Cohen?
yes, it raises, I think there are a couple points to make. There are different strokes for different folks. Everybody's in a different place, and need to have networks and alliedships where they are, and then go from there to make further networking possible. But I wanted to just surface the notion that we've just had the 6th International Women's Leadership Conference that was held in March 2024. The 6th one, and they're held every 3 to 4 years apart. So they go back quite a while. And it was created really to give women alliedship, to give them confidence. And there are a lot of males that attend the Women's Leadership Conference, by the way. Surprising to find who they are, because I like to go and talk to those men too. They're because they have a special need to learn how they can be better partners, if you will. But at any rate, there's lots to be gained by women allying with each other, certainly. I mean, but a lot of things need to happen, and for different people, there are different pathways to get there, and different situations. If you're in a male-dominated environment, you don't always have the ability to use your feminine counterparts to help you through that. So, as I didn't, because I came in at such early stage in the development in this country anyway. But at any rate, I just wanted to make those points to see if that clarifies.
Thank you. Moving on to our next question. The theme for the 2024 International Women's Day is Invest in Women, Accelerate Progress. What does it actually mean to invest in women in the oral sector, and how does this benefit society as a whole? Have you personally been involved with decisions or policies that have invested in women and have made a positive impact in the community? Dr. Verma, would you like to start us off?
You know, see, women are almost 50% of any population. So without investing in women, you cannot get very far. And the women is the backbone of the family. So I think that you have to give a woman her due position, and give her a chance to grow. And I also feel that a woman should want to grow. It's a lot depends on an individual also. Some people are content in doing their clinical work. Some want to go in for education in the field of education. Others want to go into hospitals. So, and some blossom into leadership roles. So I think a lot depends on the individual, what the individual wants. Every woman cannot be a leader. If you want to be a leader, the woman would find her way, and with a little support and encouragement, she will get there. You can't stop.
Thank you. Dr. Fleming?
I mean, I'll just offer, again, complicating the question. While it's important to invest in women and people who identify as women in any ways that people can be resourced and opportunities created, I think we should never lose sight of, again, how patriarchy works, how sexism and misogyny work, and do that root cause work of dismantling those systems as well. I mean, I find often, and maybe this is just how I see the world, that often we will have a pathway program or a mentorship program or something that is focused on a particular population community group, as though that is the solution, but we bring people into problematic places that are basically toxic, right? But we never do the cleanup work of breaking down those real barriers that inhibit people from being their best selves. And I just hope that while we continue to make investments in all people who have any type of interest in being in spaces that are oral health centered, that we never lose sight of this space called oral health is also operating in this context of sexism, patriarchy, and other forms of oppression. And we got to clean that work up too, in addition to how we resource people. So it has to be a both and proposition as I see it. And I think for me, if we are to be specific in ways that we identify doing this work, again, naming the problem, right? I never, whether I have the ability to hire someone or to mentor someone or to offer anything that creates opportunities for people, it always has to be the opportunity and also trying to clean up the institution, the culture. And with dentistry, I think we should be very honest with ourselves that we have a lot of deep work to do. And whether we want to admit it or not, we often replicate these systems, patriarchy being one of them. And so when are we going to turn our attention to the dismantling of that system and the creating of opportunity for folks too?
Thank you. Dr. Cohen?
Yeah, I think the theme in invest in women, accelerate progress is a global theme that is meant to accelerate or double economic and social development. That's what it was sort of predicated on. After all, women are 50% theoretically of the population. And if you only have the other half, 50%, contributing to economic productivity, and the other 50%, sort of in service to the men, that is not going to accelerate economic and social development. The old Chinese proverb, women uphold 50% of the world, men the other half. You need everybody if the whole society is going forward. So given that notion, of course, it folds out to all the health sector, including the oral health. And in the general health sector, one major example is often promulgated, and that is the origin of the notion of community health workers. Started, I believe, in India or with Bangladesh, where a man was assigned to go to a rural community to sort of accelerate or to advance health promoting behaviors, and was not successful until many incidents later they put a woman into that role and was able to motivate and use women in the home setting as examples of how women can help other women, families in a community. And that began to be successful. It was using indigenous workforce to grow a health workforce. And so that movement started to blossom all over the world. And it started as a feminine, female-centered, in a rural community environment. So it was a way of making the economy blossom through health. And this is just an opportunity for us to think about oral health and how can we use the other half of the population, theoretically. I'm not talking about the whole of gender demography here, but women as a cohort, how we can accelerate self-promoting oral health. One concept.
Dr. Mlisami, do you have anything to add?
Thank you, Dr. Bentley, Dr. Cohen. I would love to talk about investing in women. I absolutely love this, the theme for the next year. And as 50% of the population, as Dr. Cohen alluded to, working on women's health, which has received so much more attention in the past 5 to 10 years, is essential in getting women to be economically independent, to re-engage back into the society, and to push all the boundaries that Eleanor talked about, and everything that we want to achieve this. And so, I'd like to talk about investing in women at 3 levels. So for the work that I've been involved with in the past 15 years, the nonprofit work, our motto is to invest in the oral health of survivors of gender-based violence. So these are women that are usually at the intersection of sexism, racism, and really the women that are most at risk of extremely vulnerable populations living in shelters. So what we've learned over the past 15 years was that the act of providing care to survivors of gender-based violence and interpersonal violence it went much further than we anticipated. It went much beyond just restoring their oral health. And what we have learned is that by reconstructing their oral and facial function, getting them out of pain, and giving them confidence, because many of these female identifying individuals lack the confidence because of their past events, has given them the confidence to go further and to give back themselves. So we've created this snowball effect. And what we've also learned is that by helping and restoring and reconstructing their facial and oral their aesthetics and function, we've actually helped unintentionally. We've had a big impact on their mental health. And so we've learned that we've learned so much about the intersection of trauma and everything else that goes on in the vulnerable lives of the women that we treat. And so I think one of the biggest lessons learned in our organization was to understand and deeply appreciate the impact of trauma, early childhood trauma, the repeated exposures to trauma, abuse, and what it creates. It really creates a monster in the human brain. And the post-traumatic stress disorder really comes back and it hijacks the amygdala, and to the point that women are completely catatonic, not able to function when they're triggered or re-exposed to certain situations. So I bring this up because what we've noticed again and again is that by providing that care, that compassion, we're not just reconstructing the physical self, but we are restoring the mental self because of the brain's neuroplasticity and the brain's ability to recover and recuperate. So, what have we seen? We've looked at our results over the past 15 years, and we see tremendous economic impact on this matter. And I think the key is to appreciate, as Eleanor was alluding to before, it's to appreciate the detrimental effect that misogyny and sexism and violence has on women, but then also appreciate the steps that can be taken as a holistic approach to heal these individuals to come back to the workforce and to society.
And I think if you can add to that, right, like that, what you've just shared is the thing, right? I mean, it's great to talk about women and leadership in dentistry and all of the amazing things that we can do, but to never lose sight of the people dealing with intimate partner violence and gender-based violence and all of the ways that shows up. And to the degree that we're looking for opportunities where there are levers to improve conditions and, again, to transform oral health, you named it precisely, right? Trauma-informed care, how we train our providers of whatever provider type you are operating in oral health to see the signs and to understand that fixing the tooth, as you said, doing the outward work, folks also need support around mental health and housing and security and all of those other things. And I think if we see ourselves as leaders and people who have specific skills and abilities to understand the world that other people don't, to see that problem that is a systems social problem and to be able to intervene, right? To be the provider, to be the advocate, to be the ally for folks who will never have the opportunities that we have, like just being honest. But what can we do to improve conditions for all women, all people who identify as women facing gender-based violence? And where does the clinical care, the policy work, the proper medic work align in that? And so I applaud you in naming that and in doing that work, because if we look globally and think about people and conditions, we've got to be in that space too.
100%. And this really, I have to tell you, this really worries me because in the dental school curriculum, not only is there no education in psychiatry or psychology, but I feel that to a big extent, the students and practitioners are actually warned against getting involved in treating at-risk patient populations. I came across a situation that was a clear human trafficking in my practice, and I tried to intervene. It was a very difficult and very emotional situation until the police arrived. But it was a suspicion that I had. I called it. They came. She's safe. But I really got my wrist slapped for calling it out, because my college will not protect me should this individual's abuser decide to file a complaint against me for the college. So the issues are so deep, and the work is so huge and tremendous, that I actually talked to Lisa about this. I think a couple of years ago. We were thinking about, well, how can we bring this? How can we make this society more aware that these things exist, right? And so at least reduce the barriers to women getting access to care by demystifying, PTSD or mental health issues, and making people understand that women are, the women that have been abused, they're not being hysterical, or they're not drama queens, right? You have to appreciate the cycle of abuse and trauma to understand why they present the way they present, and then how we can better treat them.
Yeah, it suggests to me making this more visible in health professions education. And maybe the college, maybe this is a particular opportunity for women and men to be educated about this, when recognizing it in practice. And also, as you both, Eleanor and Tina, you mentioned the need to integrate social services, mental health services, a whole array of social determinants around patient-centered care. It's not just specifically dental care or oral surgical care. It's other supportive services that precipitated the situation and can take care of the situation. So that the movement now toward integrated health, where oral is integrated back into primary health care and is not siloed out, it sort of fits this trend that's now happening, or we hope is happening, where we integrate the mouth back into the body, that it's not siloed out.
Thank you.
And this is a good avenue to talk about it and maybe raise this more specifically in those vehicles that pertain to health professions education. That's where I would start.
So this is an excellent.
This is quite an eye. Yeah.
This
is quite an eye opener, because I really don't encounter so much in our practice in our daily lives, and so many women suffering and in this form and with this sort of abuse is something which really needs to be taken up on a very, very, very serious.
Thank you. This is an excellent segue into the final question of the day. The current global economic system disproportionately affects women. Advocates propose a shift to a green economy and care society to amplify women's voices. What is the role of women leaders in oral healthcare sector to support this shift? Dr. Fleming?
Again, I hate to sound like a broken record on this one, but second verse, same as the first. As we think about large global needs around climate justice, around access to all of the things that we would hope people would have access to, including safety and security and not living with threats of violence. To the degree that women as leaders show up in these spaces and name the root cause of oppression and do the work to dismantle those systems and not showing up, perpetuating, right? I mean, we haven't named this in this space, but to add to our agenda, in my experience of some women who are leaders is that they do know better than the men, right? They just happen to be in a body that presents as a woman. And so to the degree that we name and accept that we have perspectives and understandings that allow us to see bigger pictures and to bring folks along in whatever ways that we're bringing them along, it has to be in service of something that is better than we have now. Because if we're only maintaining a status quo and following paths that have led us to the gross disparities, right? The inequities that we have been naming for decades and have yet to resolve, like, what are we doing? And if it's in service to ourselves as the leader, like, I don't know if that's it. So to the degree that we can work across systems, work across spaces where we're not just the dentist who knows teeth, but that we are the hygienist, the community health worker, the dental therapist, the oral surgeon, the whatever, who understands or is curious about education, transportation, climate change, and all of these things, and can bring that to those tables. Like, to me, that is the place of opportunity. But doing what we've seen other people do and then hoping that we're going to get better solutions, that will never happen. And if we think that that is parity, or is getting us somewhere as people who identify as women, I encourage us to be critical as to what we want the end to be. More of the same, or better and different for other people. And if you look at women's liberation efforts around the globe, they've always pushed for something that was different and better and inclusive of all people, because none of us are free until all of us are free.
Thank you so much. Dr. Verma, do you like to weigh in on this question?
I feel that women probably could do something, for the environment. That is a big red flag all over the world today. Here, currently, we are having a heat wave, temperatures going over 50 degrees centigrade. So something we have to put our minds together. I can't pinpoint exactly what, but we have to put our minds together and do something, because the universe is not going to last forever. Maybe some biodegradable stuff, maybe there's something which we are missing out on, which will be useful for our future generations. We have to put our mind, and the scientists have to think, all of us have to think conservatively, and we have to work for our next generation.
Thank you. Dr. Cohen.
Yeah, I think it's a wonderful subject that has had only minimal attention in the dental sphere. You can count on your one hand probably the number of articles that have looked at climate change and oral health and how it affects this community and what can be done by this community for the greater good and for doing something different, as Eleanor said, that's better. And I just came a few weeks ago from the Association for Dental Safety, which was formerly called OSAP, Organization for Safety, Asepsis, and Prevention. That's the Dental Infection Prevention and Control Organization. They've just rebranded to this Association for Dental Safety. And we were really thinking about the future in dental infection and prevention. And think about our instruments and our supplies that are throwaway and are not contributing to sustainability, environmental sustainability. So from the very things that we do in the clinic to where we operate, and even for self-care, there are things that can contribute to environmental safety and security. And as far as women are concerned, we have an opportunity here, a window of opportunity that we could step into. Men can step into it too, but bright women can get there first if they want to, and start with the materials that we deal with every day. And are they sustainable?
So your lecturer at that conference was Dr. Lori Houston, who was a very dear friend of mine. And she's an expert in environmental sustainability and the greenhouse gas that dental procedures produce. So I know that I'm not sure if you saw her lecture there, but she did go to Arizona to present to your group.
Yeah, that I know there was discussion and excitement about that vision. It's a whole empty space.
Yes.
For people, and quite honestly, the people who have written about it are women. That it's in the literature. So I think we better get on the bandwagon and go with it. Go with the flow.
I'm going to finish off the discussion with you, Dr. Maysami.
I agree with all the wonderful points that have been made. And on this particular point, even in our community at North York General Hospital, it's a community hospital. As you said, Dr. Cohen, the initiative was started by female anesthesiologists, and then the female surgeons joined in. And I think, it's a much bigger movement now at University of Toronto. And I think the most important thing is for us to continue to advocate for female leaders to, not just to network with them, but actually grab their hand and push them through those, boardrooms and around the tables where these discussions are taking place, where policies are being made. I think that's what we have to strive for. And so, that's the kind of advocacy I would love to be able to invest in, to see women in those places.
Thank you so much, everybody. This was a really insightful discussion, and I thank everybody for joining me today. Thanks. We look forward to seeing you at the next ICD Online event. If you have a relevant or interesting topic you would like to see presented by ICD Online, please let us know by contacting the email on your screen. We'll see you soon. Thank you.